My second example is another virus, Nipah. This was first reported on the Malaysian Peninsula in 1998, in which pigs and pig workers were reported to have neurological and respiratory signs, this disease was associated or thought to be caused by infection with the paramyxovirus or the Nipah virus. As I said, it tended to occur in people that had a very close contact working with pigs, and although the virus caused comparatively mild signs in pigs, it had approximately a 50% fatality rate in people, and over 228 human cases were recorded. Nipah virus has been shown to be carried by local food bat populations. The bat and is considered to be the natural reservoir of this virus. Bat populations are thought to have moved into agricultural areas as a result of a combination of deforestation as a result of for agricultural purposes, but also the fact that prior to this there was a serious drought associated with El Nino, and at that time there was significant bushfires in the areas affected. The index cases associated with bats was associated with bats feeding in an orchard neighbouring an intensive pig farm, and it is thought that infection spread to the pigs, and that and through this close contact, and that this infection was further spread with the transport of live infected pigs throughout areas of Malaysia. So again, pigs are actually acting as an intermediary amplifying host for the virus and allowing the virus to come into contact with humans, whereas previously that contact would not have occurred. An interesting aside from the Malaysian event is that subsequent detections of Nipah have been detected in Bangladesh and India, but without linkage to pigs. And it's thought that people harvesting dates from date palms are actually ingesting the virus with dates that have been contaminated by the urine of infected bats. This disease transmits readily between people, and therefore has been classified as a level 3 disease on the pathogenic pyramid. The third disease example that I want to talk about is Zika virus. Zika obviously has received a lot of attention following the Olympic Games in Brazil, and it is actually currently the focus of an ongoing public health program in many regions. It's caused by a flavivirus that was first isolated in 1947 from the rhesus macaque monkeys in Uganda, and was later identified to be in mosquitoes that originate from the same region. It's thought to be a disease that has actually been with us for some time, but probably not caused major concerns until the present time, where it's reported to have emerged from East Africa during the late 1800s and early 1900s. And since that time, basically was characterised by only causing sporadic cases of disease in Africa and Asia. In 2007, there was a major outbreak of Zika virus infection in Micronesia, and since then the infection has spread rapidly throughout that region. More recently, 1.3 million persons are considered to be affected in Brazil, and the virus is spreading within the Americas. Most human infections of Zika are actually characterised by subclinical or disease or mild influenza like symptoms. However, there are more serious cases associated with Guillain-Barré syndrome in adults, but what is really very much reported in the media is the associated microcephaly in fetuses of infected mothers. More recently that in examination of these cases, there's more than 3,800 cases been reported, which represents about 20 cases per 10,000 live births in Brazil. Now, that suggests a significant increase in the incidence of this condition, but that could be a false high result due to greater knowledge, greater PR, greater media status of the condition. Questions remain about the principal vectors and reservoirs of this virus. Obviously, if we had close association with monkey populations, then it would be reasonable to assume that the virus was being transferred from these populations. However, many areas do not have these populations, and although mosquitoes are considered to be the principal vectors of spread, the reservoir of this virus has yet really to be, the natural reservoir of this virus has yet to be confirmed. One possibility is that humans are actually acting as a reservoir, and spread is occurring amongst from human to human. Direct transfer of the virus in humans has been demonstrated, and can also occur through sexual contact. So, as I said, the principal transmission mechanism for Zika is mosquitoes, and there are several species that this can occur with. However, as it is spread to new areas, a number of other species have been shown to be able to spread the virus also. Mosquito vectors inhabit the mosquitoes inhabit most warm and tropical and subtropical regions of the world, and it would be expected that the range of these mosquitoes would increase with increase in climate change. This is a vector that readily moves around the world with air travel and in international cargoes. And in fact, there is one theory that Zika virus was actually spread to Brazil through the movement of, or the importation of large quantities of tyres in which water was carried with mosquito larvae. Disease control is currently based around spraying for mosquitoes in an effort to reduce their numbers. So the final disease example that I'd like to talk to you about is SARS. This is a severe respiratory disease caused by a novel coronavirus. It was detected it occurred a major outbreak in China during 2002-2003, and during that outbreak spread to approximately 37 countries, resulting in more than 8,000 cases being diagnosed, and approximately 10% of those were shown to be fatal. Prior to the SARS event in China, infection in humans with coronaviruses was thought to be associated with only mild flu-like symptoms, and was not of great concern. However, early investigation found an association with people's handling wild animals and sales in the Guangdong market area in China. And during these investigations, it was found that the masked palm civet was considered to be an intermediary host for the SARS virus in a similar way to what we have seen for pigs, for Nipah, and also horses for Hendra. Bats are considered to be the natural reservoirs of the virus, and therefore the markets that are harvesting bushmeat in China are providing a mechanism by which this bushmeat species can become infected and brings it into close contact with people. And this is thought to occur actually in the markets themselves. Serological testing of civet cats outside the markets does not show any infection with the SARS virus, and there is thought to be a possible link here with stress and immunosuppression, which may play a role in civets becoming infected in this environment. So, in summary, what I've done here is I have taken the 4 disease cases that I've discussed here and tried to basically summarise in these 2 tables the factors that are contributing to their emergent as zoonoses in our current environment. The codes here are, Y for yes, this is definitely a contributory factor. Where I haven't been sure but considered that it may actually be a possibility, I've marked the square with a P and obviously N for no, and then a U for unlikely. That's my final presentation. I hope you enjoyed it, and thank you very much for patiently listening.